Hi everybody, welcome to Beauty Buzz with Lori. So today I have Dr. Garcia here with me, and we're going to actually talk a little bit about a question I get asked often. So I see your patients at their 2-week post-op from facelifts. The purpose of that is to do a lymphatic drainage to help with reduction of swelling and also help with some of that lumpiness they might feel from the platysmoplasty. The question is, I thought that I would be completely healed at 2 weeks.
Right.
So maybe that's not a question, that's a statement,
Right.
but they are asking a question. So why am I not fully healed at 2 weeks? So there seems to be a misunderstanding between 2 weeks recovery,
Right.
back to life, and the actual healing process. So can you kind of elaborate on that for us a little bit?
Yeah, there's always a difference between surgical recovery and actual healing. What we do is just like any other surgery. There is a recovery period, and what recovery means is when are you going to be healed as far as incisions are concerned? When are those incisions strong enough for you to resume your normal life activities? The answer to that question is 2 weeks. When are you mentally going to be ready to move on with your life in terms of whatever you want to do, social activities, physical activities? The answer to that is 2 weeks. So that's your surgical recovery. However, the healing process after surgery takes a long time. There's no way to get around that. It's just the nature of biology. It's the nature of the human
Sure.
body. What you will experience throughout this healing process, a month after surgery, 3 months, 6 months, even up to a year, is resolution of the swelling. The swelling is what's manifested as lumpiness, contour irregularities. Lumpiness at that time after the 2 weeks is something that you only feel when you touch your face.
Right.
You don't see it, which is why we tell patients go back to social activities at 2 weeks, but you do feel it. You feel tightness, you feel lumpiness. And that's why it's so important for the overall healing process to engage in that systematic process of doing massages and,
Right.
and the skincare and all of that.
Basically, what you're saying is that you don't want to be hyper focused on your healing process because your
Right.
body's going to heal regardless of how focused you are or not. So you
correct.
might as well just get back to life. That helps with the mental aspect
Absolutely,
of the physical too.
100%. I'm a big believer in what you just said. The mental recovery after surgery is just as important as, if not more important, than the physical recovery. You need to move on with your life. And that's a point that I stress to all of my 2-week patients. You need to stop worrying about surgery. There is nothing you can do wrong at 2 weeks. Go back to life. Go
Right.
back to strenuous physical activity. Go back to doing whatever you want to do because you're going to recover whether you worry about it or not.
Right.
And I think once patients believe that in their mind, the part beyond the 2 weeks is a lot smoother. And they have a tendency, anecdotally, I have seen that patients who don't worry about the healing process have a much smoother healing process and a much
agree.
quicker healing process. I don't know if you've seen
Yeah,
that in your
I would
practice.
agree as well. I find that, so it's kind of funny and I laugh a little bit because in our industry, whenever people are healing, they don't think that you can necessarily tell if they've been doing what they're supposed to be doing, what they've
Right.
been instructed to be doing. So sometimes they'll say, oh yeah, I've been doing my massage. And I'm like, have you though?
Right.
But I think it's important at this point to mention the letter that you give your patients at their 1-day post-op.
So I give every patient the day after surgery a letter. It's a lengthy letter that talks about everything that they're going to experience. And it talks about those mental things. It has to encompass the physical part, it has to encompass the mental part.
Sure.
And all of that is addressed in the letter. There's some very reassuring language in that letter because, believe it or not, there are a lot of common denominator issues with
Sure.
my patients.
Yeah, I kind of liken it to going to the salon. You go into the salon, you get your hair done, you come out and you look amazing. This is not that.
Right, it is not that.
Your amazing look is going to be a little bit down the road
Correct.
whenever you're fully healed.
Correct.
I think it's important to remind patients too that this is major surgery. This
It
is,
is.
even though it's cosmetic, I think sometimes people think because it's
They trivialize
cosmetic
it.
surgery, yeah, they don't think it's as important.
It's more of the societal influence on cosmetic surgery.
Right.
People tend to put cosmetic surgery in that category of going to the hair salon and going to, doing something short term. Although there are short term processes that we offer in this office, if you are taking scalpel to skin, it is surgery.
Right.
It is serious. I tell patients all the time, there is no such thing as a minor procedure. All procedures are major because they are all fraught with potential complications, infections, bleeding, and so on and so forth. So I tell patients to take this very seriously and to take the instructions and the counseling very seriously. Patients do fine. 99% of the time they do fine and there's no issue, but you also have to be prepared for any imponderables that arise.
Absolutely. A lot of patients also tend to hop on Dr. Google and YouTube and all that kind of stuff. When people are trying to compare their situation with another situation, I think it's important to mention that everybody's different. Even though a lot of our anatomy and everything is the same, we still have differences that come into play. There's just a lot of variables to consider with this.
That's right. Yeah, so that's a very good point. We deal with the science of biology. No doctor, no scientist has completely corralled the science of biology. Biology is a bell-shaped curve. There are patients at this extreme, there are patients at this extreme, and then the majority of patients are in the middle part. And so whenever you deal with biology, there's never any guarantees. And we tell patients our expectation within a reasonable amount of assurance is that you fall within this part. However, we don't control everything. We try to mitigate, we try to control, and most of the time we do, but it's not 100% of the time.
Sure.
And so getting on websites, Google is in the business of getting clicks. And the things that get clicks are not necessarily reality based. For example, I tell patients all the time, the only time you hear about airplanes is when they crash.
Right.
So unfortunately, the only time you hear about plastic surgery is when it is extreme, when there's a complication, whenever you have those kind of dramatic events happen. 99.9% of the time that I operate on patients, it is routine, it is boring, and it yields excellent results.
So I hope this information has been helpful to you. If you have been thinking about a facelift or any type of facial surgical procedures, give us a call, schedule a consultation, and we look forward to hearing from you.